with that, I want to transition to some of the questions that we have received from our listeners. Dr. Kutros, there's many questions focused around sort of the smoking, and
Yeah.
so um, so sorry, I was just reading the chat. I got a little distracted. So I think this goes back to sort of the dosage and timing conversation, or that that Dr. Patel was discussing, but the effects of smoking history. I guess many of our listeners want to know, you where sort of the where does the risk kind of increase? Does it does it have to be continuous? What if it was only a pack for 10 years, 10 years? So like I guess the dosage and the quantity and the timing is sort of if you have more insight to share around that.
Yeah, so we know pretty confidently that if you ever smoked, you have a higher rate of bladder cancer. And yes, the number of years and how the packs per day you smoked all definitely influence that. So people who are current smokers at the time of diagnosis, regardless of how many years, tend to have longer duration of smoking, but they have the highest risk of smoking. People who are they have about a 4 to 5 time higher risk compared to never smokers. People who are former smokers have a lower risk, about 2 to 3 times higher than never smokers. And it does increase with duration, but regardless of whether you smoked for 10 years and then maybe stopped for 30 or 50 years, that 10 years of smoking is still enough to increase your risk of bladder cancer compared to not smoking. So we do know that. And yeah, those things are important. And part of the reason that with the exposures we talked about today, we want to get a sense for that history, because we know that bladder cancer and a lot of cancers have a long latency. We know they develop many, many years down the road. So even those 10 years of smoking that you did, or, the few years you might have worked in aromatic amine manufacturing facility, those will still be important many decades later.
Okay, thank you for reaching out. Does that how about secondhand smoking?
Yeah. So secondhand smoking has been a little bit of a mixed bag. I mean, the results in the human studies and the epidemiologic studies have been mixed. There are some studies that have shown positive association. Some studies have shown it's really not that much. So I would say compared to tobacco smoking and even some other smoking, I think somebody said something about cigars, but cigar smoking has also been linked to bladder cancer risk. I would say it's a little bit more mixed about secondhand smoking. What we really know for sure.
Okay, thank you. And so what would be sort of um, an advice that you would give to those who are exposed to secondhand smoke, say people working in casinos?
Right. I mean, I think it's difficult, right? Because one thing, I should have said, a lot of, I think I put in my slide that some exposures are modifiable, but when they're in our workplace, it's not exactly voluntary. We have to work and people have to make a living. And so, it's difficult to sort of balance that. And we kind of have to understand the sort of risk for bladder cancer through that lens of these voluntary and involuntary exposures. But obviously, we would recommend that exposure to cigarette smoke is, we would like to limit it as much as possible.
Thank you. Uh, so you talked about different occupations, hairdressers, firefighters, and so military. For some of these, should there be some sort of surveillance program, particularly those that have been exposed, and what that may look like in terms of like screening, like urinary tests, for example?
Yeah, so we don't have right now a really sort of validated screening test for bladder cancer. So that makes it difficult to make any recommendation for sort of screening programs per se. It's not, certain other cancers have recommended screening tools that have, proved to be useful, and we haven't gotten there with bladder cancer yet. There's a huge amount of clinical and research work focused on this question in particular, sort of trying to see whether we'll be able to get to a place where we can look at a person's urine and blood and see if we can detect cancer early. I think there will be a lot of development in this area over the next 10 years. But because we don't have that yet, it's difficult to recommend who should or shouldn't be sort of screened. But I think we may eventually want to consider, if we do end up having a test that might work that way, what high risk groups could be targeted. We'll see. All of that is kind of a TBD at this point.
Got it. I think that's something that we're all looking forward to over the next 10 years for a screening tool to become available. And so there's a question about whether research has been done looking at sort of the substances that healthcare workers are exposed to, particularly chemotherapy.
I actually don't know the answer to that question with respect to healthcare workers. Maybe Dr. Patel would have been better for this question with respect to actually people who have received maybe chemotherapy for other cancers. I'm not sure if that's what the question is referring to. I could get back to you on that, but I don't believe, I'm not sure.
Okay. I think it was more like healthcare workers, I think some, for example, X-rays, radiology, the exposure that
I
comes with
see.
that.
Oh, okay. Well, if it has to do with radiologic sort of risks, those have not been sort of determined among healthcare workers for bladder cancer. What has been kind of identified is that people who have been exposed to radiation, either pelvic radiation for some other cancer diagnoses. There's evidence there that people who've had the type of exposure have increased risk of bladder cancer in the future. Also, information from sort of radiologic events like Chernobyl. We see elevated rates of bladder cancer after those kind of big events. So there is a body of evidence sort of in some specific settings that radiation is a risk factor for bladder cancer.
Okay. And I just got a note from the person that asked the question. What about administering or mixing chemotherapy? Is there any data on that?
No, I'm not sure. I don't think there's any data on that at this point, but I actually think it's a really interesting question. And I believe that I actually think some of our colleagues in Canada are thinking about something similar to that. But as of right now, we do not know. I would say we don't have enough information on that.
Okay, thank you. I think Dr. Patil talked about sort of other factors that elevate the risk for the exposure. So as there's a question here from one of our listeners who wants to know, as a hairstylist who has a dad who just had bladder cancer, is my risk higher due to the genetic factor?
Yeah, so it's well, just considering the fact that your father had bladder cancer, that is a risk factor. So people who have a first-degree relative who have bladder cancer do tend to have a higher risk of bladder cancer themselves. So we do have enough information that there is a risk related to genetics in that regard. And what those genetic factors are exactly is still something we're trying to understand more and more about, and we've done a lot of genetic studies. I had it in my talk there, the link to one of our sort of larger comprehensive studies on genetics, and and we're understanding more about the genetic contribution. But having a family history is definitely a risk factor.
Thanks for addressing that. And so we're almost at time, so I have two more questions. The one question is, there's a lot that I hear around microplastics and the risk. Is there any evidence, data on microplastics at the moment, and any connection to bladder cancer?
Sure. Right now, there is no evidence about microplastic exposure and bladder cancer risk. One of the biggest reasons is what I said about exposure assessment. This is going to be a really challenging thing to study for cancer because it's a relatively sort of newer exposure, and we understand it could take decades for something to sort of manifest, but also we haven't set up studies up until this point to deal with the contamination issue from plastic. If you think about it, the blood draws and the tubes we use, all of that is plastic. And so even for some of our studies where we have some banked biological sample collections, it will be really difficult to use that or leverage any of that data in the context of this contamination issue. And so people are just beginning to deal with some of those considerations and try to develop some studies to understand what the health effects might be. But it's very new area, and right now we do not have any information about bladder cancer risk specifically.
Okay, and what you mentioned was a great transition to my last question before we close, which I'm going to couple with another question. So the first piece of that question is, what can patients do to help advance the knowledge in the field of these exposures, risk factors, and then also what can patients and their families do to reduce their risk?
Yeah, I mean, I think part of the reason that Dr. Patel and I are always really happy to be here with Beacon in the community is because, I mean, communicating these risks and educating people is one of the number one ways you can pass along that information to your family. I had a researcher who was here, and I was talking about gasoline, and he was like, "Oh my God, I like to, work on repairing, putting old cars together, and I use gasoline all the time, all over my hands, just because to do this stuff." And I said, "Well, you might want to consider wearing gloves when you do that, or and in the context of environment, for people who might be on a private well, communicating with you or other relatives to sort of make sure you test your wells to make sure that the levels of arsenic are not above sort of what we want them to be, because they're not regulated the same way public water supplies are regulated in the United States." So, hearing sort of what sort of the key risk factors that we already know about and trying to sort of pass that information along to your family, even if you're a bladder cancer patient already, sort of passing that knowledge on to others is, I think, an important thing that we're doing here, and that I always appreciate Beacon's invitation to share that information.
Yes, knowledge is power. Thank you, Dr. Kuchos, for being here with us today and for sharing this information and shedding light on all these different occupational, environmental risk factors that we're exposed to on a day-to-day.